Good morning, and thank you for joining us for Sbblive. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Really delighted today to bring on these lovely ladies from Park Royal Hospital. We have Megan Palumbo and Jessica Bennett with us this morning. How are you, girls?
Wonderful.
Good.
Thank you so much for having us.
Thank you for spending your morning with me. I really appreciate it. Today, we have a really interesting topic. We're going to talk about something that even I was really uneducated on. So, very excited to talk about ECT. So, Megan, I'm going to start with you. Do you want to tell us exactly? We do use a lot of acronyms in this industry. What does ECT stand for? What exactly is this type of therapy?
Great, thank you so much. ECT stands for electroconvulsive treatment, and it is a very effective form of treatment for patients that are suffering from major depressive disorder and other mental health disorders.
Awesome. Thank you so much. Jessica, tell me who would be a good candidate for this type of therapy?
Yes, thank you. So ECT is a very effective form of treatment for clinical depression, and it's used to treat depression that's resistant to other modalities of treatment, including medication and psychotherapy. And it's one of the fastest ways to relieve symptoms in the severely depressed or suicidal patients. It's also very effective for patients who suffer from bipolar disorder, catatonia, and some psychotic states.
Very interesting. Now, what would the process be if you were going in to get ECT, Megan? What exactly is the process?
Sure, and if I could just piggyback on what Jess had just mentioned, ECT is a very effective form of treatment for people that do have treatment-resistant depression, meaning that traditional therapies or medications are not working. It helps enhance the effectiveness of those therapies and treatments. So it's important that, when we look at it as a last resort treatment, it's not only a last resort treatment.
Okay.
Is a common misconception about it is that anyone can benefit from ECT that, really would like to boost the effectiveness of other treatments that they're undergoing. It's about 70 to 90% effective for patients that are suffering with severe depression.
Wow. And I think we all probably are suffering a little bit from that now.
Yeah, absolutely. I think we've all experienced some symptoms related to mental health disorders. So if you can relate to somebody that is in that state and is feeling really discouraged that, you're on your fifth different depression medication, and just think about how discouraging that is when you're not getting the results that you were hoping to have. This patient, we see patients that come in and, their lives are completely transformed after even just their first few treatments with us. And, what they get to say to us, and, that they're able to participate in their lives again. It's truly transformative. It's an amazing therapy. And so I go ahead. I'm going to let you say your question one more time.
No, that's fine. The process of ECT when you're going in for it, what would the process be?
Sure. So Park Royal Hospital actually has a 6-bed ECT suite. We have been offering ECT treatment since January of this year. It's only been offered to our patients that are staying inpatient with us in our other programs. But as of this month, we've actually opened the door for outpatient ECT treatment.
Wow.
What that would look like if you were considering receiving this treatment, definitely talk about it with your provider. Otherwise, you can give us a call. You can go to our website, which is www.parkroyalhospital.com/ECT. You could actually make an appointment right there with our admissions department, and you would come in and we'd assess you right there on the spot. We would probably have you complete an EKG and some updated labs if we haven't had those already from your provider. And if you're a good candidate, we would want you to get started right away. So probably within a couple of days of that assessment, you'd be undergoing your first treatment.
Awesome. Now, Jessica, I know there's been a lot of success stories with this. Do you want to talk about some of those cases?
Sure. So we have had, we're going to get some of our patients who have had it to give some testimonies and hopefully do some Facebook Lives.
Great.
I can tell you about two patients that I know. This one lady in her 40s who has bipolar disorder and borderline personality disorder and was extremely depressed and just really struggling, hadn't had a job in a long time, had to get on disability and on about 26 different medications,
Wow.
really not finding any relief at all. So she was recommended and for ECT and chose to do ECT. And it was several months in the process. She went once a week, I believe, and had about 12 sessions. And from the beginning to the end, she would come in the hospital and they would take her off. She had to get off some of her medications to have the procedure. So they would take her off some of the medications before she would go. And in that process, I just saw her getting a little bit better each time. And at the end of the process, I think with her, it was about 9 months. And at the end of the process, she went into our PHP program, which is partial hospitalization. And so she attended that program 5 days a week, 5 hours a day, then stepped down to the IOP, which is 5 days a week, 3 groups a day, and then did aftercare once a week, and then graduated. She never came back into the hospital after that. And I ran into her working at a hospital.
Oh,
So
wow.
only on, I think, 1 or 2 medications after that, and got a job, was able to get an apartment, and just really got her life back. And it was the most dramatic change that I've ever seen in anyone.
That's amazing. What a great testimonial. We'll definitely get the way to make an appointment up on the live. And just want to thank you ladies so much for your time this morning and explaining what ECT is to us.